Several long-acting or permanent methods of birth control are available. These are best for people who do not want to become pregnant in the near future or ever. These methods are very effective, mostly because you do not have to remember to do or take anything on a regular basis. It can be difficult to decide which birth control method is best because of the variety of options available. The best method is one that you will use consistently and that does not cause bothersome side effects. Other factors to consider include: how effective is it in preventing pregnancy? Do I need to remember anything to use it? How long does it work? Can I get pregnant when I stop using it? Will it affect my monthly period? Will I have side effects? How much does it cost? Does it protect me against sexually transmitted infections? Can I stop using the method on my own if I choose? No method of birth control is perfect. You must balance the advantages of each method against the disadvantages and decide which method you prefer. Intrauterine devices, IUDs, are placed by a healthcare provider through the vagina and cervix into the uterus. Most are made of molded plastic and have a string that you can feel inside the vagina, but that does not extend outside of the body. IUDs currently available do not increase risk of infection, ectopic pregnancy, or infertility. An IUD can be removed by a healthcare provider at any time if you wish to stop using it, i.e. if you want to get pregnant or switch to a different birth control method, and the birth control effect reverses rapidly. Two types of IUDs are currently available. Copper-containing IUD, brand name Paragard, prevents pregnancy by preventing sperm from reaching the fallopian tubes. The copper-containing IUD lasts for at least 10 years and is highly effective in preventing pregnancy. The pregnancy rate in people who use a copper-containing IUD is less than 1% in the first year of use. Some people who use a copper-containing IUD have heavier and longer menstrual periods. IUDs with progestin, levonorgestrel, brand names Mirena, Kylena, Skyla and Liletta, prevent pregnancy by thickening the cervical mucus and thinning the endometrium, the lining of the uterus. They also decrease menstrual bleeding and pain. Although IUDs can be removed at any time, the Mirena and Liletta IUDs can stay in place for up to 8 years. Kylena can stay in place for up to 5 years, and Skyla can stay in place for up to 3 years. All are highly effective in preventing pregnancy. The pregnancy rate in people who use a levonorgestrel-releasing IUD is less than 1% in the first year of use. In the first months after placement of a levonorgestrel-releasing IUD, irregular bleeding is common. Over time, less bleeding occurs. For many people, this is a desirable side effect. Some people completely stop having menstrual periods while using a levonorgestrel-releasing IUD. This is not harmful and does not require treatment. Menstrual periods will return when the IUD is removed. Other benefits of progestin IUDs include fewer cramps with your periods, less pain if you have endometriosis, a condition in which cells like the ones lining the uterus grow outside the uterus, and lower risk of pelvic inflammatory disease. This method is a prime choice for those who may not wish to become pregnant for at least a year or even longer. IUDs offer a high level of effectiveness without the need for daily or weekly attention. They're also a viable choice for individuals who either do not wish to or cannot safely use estrogen. Intriguingly, there is evidence that IUD use may even lower the risk of cervical cancer. IUDs carry relatively few side effects and are reversible. Should you decide that you wish to become pregnant or that you simply want the IUD removed, this can be achieved swiftly by a healthcare professional. Importantly, IUDs do not affect your chances of becoming pregnant once they are removed, meaning you can begin trying to conceive immediately. However, there are precautions to consider. IUDs should not be used if you've recently had a pelvic infection, such as gonorrhea or chlamydia. If the IUD moves or falls out, a backup method should be used until you can consult with a healthcare provider. Now, how does this compare to other methods of birth control? Let's consider the Nexplanon implant, a small device inserted under the skin of the upper inner arm. This method is highly effective for at least 3 years, with a pregnancy rate of less than 1% in the first year of use. The implant begins to protect against pregnancy within 7 days of insertion, though if inserted more than 5 days from the start of your period, backup birth control should be used for an additional 7 days. The most common side effect of the Nexplanon implant is irregular bleeding. Just like the IUD, the implant is also reversible. A healthcare provider can remove it at any time if you wish to cease using it, and its contraceptive effects reverse rapidly. Lastly, there are permanent procedures such as tubal ligation and vasectomy. These methods should only be considered if you are certain you wish to permanently prevent pregnancy. In conclusion, the world of contraceptives is filled with choices, each with its own set of benefits, precautions, and levels of effectiveness. Whether you choose an IUD, an implant, or a permanent procedure, the most important thing is to select the method that best suits your individual needs and lifestyle.